Okay, so in this video, we're going to be talking about our last long-acting reversible contraceptive, the IUD, intrauterine device. Now, there are two different intrauterine devices that we're going to be talking about. Firstly, the copper IUD, and secondly, the Lng IUD. And Lng stands for levonorgestrel releasing IUD, but basically it's another form of progesterone or progestogen releasing contraception. So without further ado, let's start with the copper IUD. We're going to be talking about an overview, some contraindications, the procedure to follow before you insert an IUD, some of the side effects, and some of the warning signs of possible problems. And then I'm going to introduce you to our IUD character right at the end. Alright, so let's go into an overview. Right, so the copper IUD is a small flexible device made of plastic and copper. So I drew this little picture over here just to show you a sort of size reference of how big it is. And here it is within the uterus, placed in here. And as you can see, the shape of it is such that it perfectly fits within the uterus and doesn't fall out. So these little knobby parts kind of secure it in place, but it's just plastic, so you just insert it like that. And then over here you can see the copper that's been coiled around the piece of plastic. So how it works is the copper coil, it inhibits sperm migration into the upper genital tract. And I always never really understood exactly how it does that, but I googled it, and according to Google, the IUD releases copper ions which are toxic to sperms, to sperm, and it causes them to be killed. So it's a form of spermaticide. And the way I like to think of it is it's like sperm kryptonite. So here's a little spermie that's being spermicided by the copper. And then the copper IUD is very safe and highly effective. It's 99.2 to 99.4% effective. And the most commonly used copper IUD worldwide, and the most effective one, is the copper T38OA. I don't know what that is, but anyways, that's what it's called. And it can last for 10 to 12 years. So in South Africa, it's registered for up to 10 years, its use. And then, but the World Health Organization claims that it can last up to 12 years. All right, and then so it's inserted into the uterus, and the good thing about this is it's safe in the use of HIV positive patients, and it doesn't affect breastfeeding, and it doesn't interfere with intercourse. Now, this may seem obvious to us, but to the patient who maybe doesn't know exactly what their anatomy looks like, this is an important thing to also mention, that it's too high up into the uterus, past the point where a penis would reach in the case of penetrative sex. So it's important just to explain this to them and even to show them a picture, which could be quite useful. So in this picture you can see it's in the uterus, and then the strings here hang down into the cervix. So then the copper IUD can be safely inserted in the first 12 days of the menstrual cycle, and then if you want to insert it after these 12 days, then you have to be reasonably certain that the patient's not pregnant. It can also be inserted straight after termination of pregnancy or a miscarriage. And then it can also be inserted after giving birth, although it's preferably inserted 6 weeks postpartum. And this is including normal vaginal delivery or a C-section. But some well-trained staff are able to put it in 48 hours after a normal delivery, and in some cases you can put it in during a C-section, so before you stitch the mom back up. And then an important thing to note is the copper IUD is also used as emergency contraception, but that will be covered in a separate video. Then let's move on to contraindications. So there are a few contraindications. The first would be, and it's quite logical, any conditions that would distort the uterine cavity, because then obviously it would be difficult to fit in a device into a distortedly shaped cavity. It might not sit nicely, or it might be expelled more easily, etc. So the things that can do this are the 3 Ps. So puerperal sepsis, pelvic TB, and current PID, so PPP. Then the other thing you want to make sure your patient doesn't have is current cervical infections. Okay, so those are the contraindications, and for those of you who sometimes forget what these fancy words mean, like me, puerperal is just around the 6 weeks after pregnancy, when all the reproductive organs and everything are starting to move back into place. So basically, it just means sepsis in around about the 6 weeks after pregnancy or after they've given birth. Okay, so let's move on to the procedure. So it is as follows. So the first thing you're going to do is take a full history as usual. And the second thing you're going to do is do a proper abdo and pelvic exam. And in the pelvic exam, you must do a speculum and a bimanual. And this is just to check that everything is in order before you put in the IUD, and also looking for any of those contraindications we spoke about. Then the third thing, so because the prevalence of gonorrhea and chlamydia infections is quite high in South Africa, but we don't really have the means for routine screening of asymptomatic infections. So instead, because we can't really screen for those, we rather just give a prophylactic single dose of antibiotics at the time of insertion. So this is just to make sure that there aren't any genital tract pathologies before we insert the IUD. So this would be 500 milligrams of azithromycin or 200 milligrams of doxycycline. And then moving on to the fourth step. So you're going to discuss the common side effects, and we'll get to those a bit later. Then you're going to also want to discuss any warning signs for any possible problems or complications that can arise from the IUD. And then the last thing is you're going to want to follow up 6 weeks after insertion, and then as needed. So if the patient is presenting with any worrying side effects or anything like that, then she'll come to you, or any of these warning signs. But otherwise, the only other time when you definitely need to see her again is when you're going to remove or replace the IUD. So in 10 to 12 years. Okay, so let's go on to discuss some of the side effects. So the side effects include increased heaviness and duration of menstrual period, irregular bleeding, and more severe menstrual cramps. But it's important to note that these are only usually present excuse me, these are only usually present for about 3 to 6 months after insertion, and thereafter they should diminish. So remember that you're putting in this sort of foreign thing into your uterus, so it makes sense that there might be some initial bleeding and some cramping, which may be due to the fact that it's trying to expel it from the uterus. So when you manage, the first thing you must do is exclude infection, partial expulsion, which may be what the cramps are presenting as, perforation, and pregnancy. Now, these are all very, very rare side effects, but it's important to just exclude them before you go on to reassure your patient that they're normal. Then, once you've excluded those, then you can counsel and reassure that they should decrease in about 3 to 6 months. Then, in the meantime, you can offer some non-steroidals to help with the cramping and also to reduce the bleeding. And then, if after that it's still unacceptable to the patient, you can offer to remove the IUD and switch to a different method. Alright, then let's go on to discuss some of the warning signs. So here we go. So this is kind of So this is really important to discuss with your patient, because these are the possible complications of using an IUD, and by recognizing these early warning signs, a lot of consequences can be prevented. So let's start. The first thing that can happen is your patient might present with the warning sign of a missed period, and the complication related to this is a possible pregnancy. The other thing they might present with is missing strings. And there are a bunch of complications that may point towards. And then lastly, they could present with vaginal discharge or lower abdominal pain, and this might point to suspected pelvic inflammatory disease. And remember that this is a contraindication. But we'll get to that. Yeah, we'll get to that. Anyways, so let's start with the missed period. So if your patient has missed a period, that's not a common side effect of using the IUD. So if they're presenting with this, you should try and exclude uterine or an ectopic pregnancy, although it is rare to actually fall pregnant while using the IUD. Then if the patient is pregnant, you're going to have to discuss some things with her. So firstly, if the pregnancy is desired or if the pregnancy is not desired. If it's not desired, you can go on to discuss management options such as a TOP. But if the pregnancy is desired, then you must first ask, is it less than 12 weeks? And is the string still visible? If it is, you can safely remove the IUD and carry on with the pregnancy. If it's more than 12 weeks into the pregnancy and the strings are not visible, you're going to need to refer because there's an increased risk of miscarriage, risk of sepsis, and prematurity. And this is due to the fact that the strings are not there, so it's going to be difficult to remove the IUD. And so a pregnancy continuing with an IUD present is going to be a bit of a risk. Then let's go on to missing strings. So your patient may not necessarily present with missing strings, but they might present with some of the symptoms associated with the complications that cause missing strings. So on examination, if you find that the strings are missing, you need to consider these things. Firstly, that there might be a perforation, although this is very rare, it's less than 0.1% of the time. You must consider that there might be a pregnancy, again, very rare, less than 1% of the time. You must consider whether it might have been expelled. And this is also more likely if your patient has been presenting with severe abdominal cramping and that sort of thing. And this is a little bit more common, but still only 3 to 5% of the time. And then it could be that when the IUD was inserted, the threads were cut a bit too short and it's just been drawn up into the uterine cavity. And then in which case it's not really a problem except for when you're going to want to remove it. So then this is how you manage it. The first thing you're going to want to do is exclude pregnancy. Then the next thing you're going to do is refer for an X-ray or an ultrasound. And this is to check for things like perforation and whether it's still there. And then you're going to want to advise that the patient use a backup method of contraception until the investigation is complete. And this is just to ensure that she doesn't fall pregnant in the case of the IUD being expelled, and that's why the strings are missing. Yes. Then moving on to the last warning sign. So if your patient is having vaginal discharge and lower abdominal pain, you must suspect that there might be a PID. And now, although this is listed as one of the contraindications to using an IUD, if you do find that your patient on examination has PID, then you don't necessarily need to remove the IUD. You can treat it while it's still in place. So yeah, that's all about that. It's just important to pick it up as soon as possible. Alright, so that is our copper IUD. Now let's quickly look at the Lng IUD. Now this one is more commonly known as the Mirena, and again it is a hormonal form of contraception. So it is very similar to the copper IUD with some slight differences. So there's a 0.2% failure rate and an 80% continuation rate at 1 year. So 20% of the people who use it have it removed by the end of 1 year. This may be due to unacceptable side effects or wanting to return to fertility, etc., etc. Then this one, unlike the copper IUD, lasts 5 years. And how it works, as I mentioned before, it releases a constant small amount of progestogen into the uterine cavity. And the good thing about this is it's a local release of the progestogens, which act at the source where they're released. So because of this, you have fewer systemic hormonal side effects. However, most of the patients do become amenorrheic while using the Mirena. Then the contraindications, so these are similar to the copper IUD. Remember the 3 Ps that could cause uterine distortion and cervical infections. Then as opposed to the copper IUD, which when inserted in the first 12 days was considered safe, and thereafter you can insert it, but you must ensure that the patient's not pregnant. In this case, if inserted in the first 7 days of the menstrual cycle, you get immediate coverage. And if after the 7th day, you need to use a backup method for the next 7 days. So remember that with hormonal methods of contraception, they take a while to kick in. So that's why this one has a bit of a delay, whereas the copper IUD has immediate effect. Alright, so that is our Mirena. And then let me just introduce you to our little character, which may or may not help you to remember some of the things. So she is a hippie surfer girl, and her name is Indigo. For Indigo, the IUD girl. And as you can see, she's a surfer, and she is very dedicated to her sport. She's an excellent athlete, and her dream is to surf the 10 or 5 biggest waves in the world. So that's how you can remember how long it lasts. 10 years in the case of the copper IUD and 5 years in the case of the Mirena. Then important thing to remember for complications of IUDs would be a missing string. So this is the little string that attaches the board to her leg. Those of you who have surfed before will know what that is, but it's just so that you don't lose your board. And as you can see here, her string has snapped and she is going to lose her board any second now. So that's just to remember to consider all the complications of IUDs, including a missing string, which might point to those various complications we spoke about. Okay, and then over here you can see that a shark is coming, and this is because she is experiencing some heavier than usual menstrual periods, and the shark can detect this. So, yeah, it's a bit strange, but yeah, that's how you can remember the main side effects of the IUD, which would be an increase in heaviness and duration of menstrual periods, or irregular bleeding. Alright, so that is our IUD, and that is all the long-acting reversible contraceptions. And that is in fact our last video. So we are not going to have individual videos for barrier contraception and for sterilization because these are quite adequately covered in the mind map that Jess has made and in the table. So make sure that you look through those things just for any extra information. But as I said, everything else has been covered. So we hope you enjoyed this video series, and I hope that it was more exciting than reading through 21 pages of course notes. Yeah, and thanks guys.